All right. You should be able to see my slides. As usual, this is for school-related employees and health department staff. So we ask you drop off a call if you're not with one of those groups, and we'll post the slides and the recording of the talk on our website later this week or early next week. Make sure you pass any needed information along to others in your organization. Just an FYI, 2 weeks from today, so February 17th, there will not be a meeting. Also, I will not be available for that week, Monday the 14th through Saturday the 19th. We were sent a message, a copy of a message that you all should have gotten. We'll make sure to send a copy of it along with the materials from this call just to make sure you did get a copy. But it was dated January 28th. It was just an update on school testing. It was, I think, 4 pages long, but one of the more important messages was just a reminder about reporting. They're not getting reports back on all the tests that are being sent out, and they determine when to send more tests based on how many you have used. So just some reminders on that. We do know, at the health department, we know that you're just not getting as many tests as you're ordering as well, just because of shortages and things. So we do know that. But again, this memo did have a lot of important information and updates and just reminders. I don't think really anything new, but just some good reminders. So we will send it out with everything else just in case you did not receive it or didn't see it. Another thing that we became aware of this week, there is another program offering free antigen tests, home antigen tests. It's only available to certain areas right now, determined based on lower socioeconomic status and risk factors. You can go to accesscovidtest.org. And before the call started, so I think it was at the 12:51 time mark in the chat box, I did post links to everything I'm talking about today, just so it's a little easier for you guys. I did post this link. You can enter your zip code to see if it's available for your area, but as of now, these are the cities and counties in our 19 county area where they are available. Each address can get a box that has 5 tests in them, and they're shipped from Amazon. They also have an online link that helps to work you through how to do the testing and keep track of your results. So I just wanted to share that. If you're in one of those areas, I'd encourage you to share it with your parents so that they can have more tests available to them, especially if you're doing a test to stay program, because that way it can help cover the shortages that the state testing program has. Another document that I put a link in the chat for, another way you can find it is if you go to, that's what this is trying to show you, if you go to my.gov/coronavirus, if you go to the resources tab here at the top, and then when it drops down, you'll go to the K through 12 school opening guidance, and then down here you'll see the FAQ tab. They did put out an FAQ document about the newer guidance for quarantine and isolation in schools. I honestly didn't find it to have any tremendously useful new information, but for some of you it might help answer some questions you have. But I just wanted to direct you towards that new document. This is another new document the state put out. It's on the home page, the my.gov/coronavirus. Just a little ways down, you'll find the Mask Up, Mask Right tab. And then on that page, the top tab there is an FAQ. This is several pages long, and it does have a lot of good information with the newer guidance towards KN95s and N95s, and it gives some good statistics about the protection that different kinds of masks can give. So the website is here, and I also put that in the chat box. for the direct link, but again, this is how you can find it within the state website. On the CDC website, the cdc.gov/coronavirus/2019-nCoV. At the top, if you go to the Work and School tab, and then click the School, Child Care, College tab, down here is the Early Childhood Education tab. For those of you who do have child care programs, early education programs, so for those that are below the kindergarten grade level, the CDC did finally update their guidance for that and essentially recommend that for all those that can and do wear masks, basically they can follow the same guidance as the general public or the K through 12 guidance. For those that are under 2, they do state that the safest option for those that are under 2 or that can't or won't wear masks, it's safest to continue to follow the 10-day quarantine or isolation, but they do mention that, essentially you can have some lenience with that based on how important it is to keep those kids in care and in a learning environment, and considering what your transmission rate is in the community, your vaccination rates and things like that. We do have word from the state that they will be updating their guidance. MDHHS and LARA had recently put out guidance that was a little more strict than this just because the CDC hadn't updated their guidance yet, but it'll be quite similar to this. So for those of you who have programming for kids under 5, you can feel free to follow the CDC guidance because again, it is a bit more flexible and easy to follow. I also put this link in the chat box and we'll send this flyer out as well. This is not COVID related, but I just wanted to share it as it was something that was sent to me and I just wanted to make sure you guys were aware of it. I have a feeling that it was sent to many or most of you as well. But just a webinar coming up later in the month about behavioral threat assessments for the K through 12 schools, kind of in light of the recent school shooting in Michigan. So again, I'll send this along with your school information and the link for registration is in the chat box right now for you. For your local data, you can go to the mystartmap.info page. The recent state data and modeling information will follow on the next slide. This is an image I took from the CDC website yesterday, just so you could see where the US is standing. Again, still very high numbers of cases, but continuing to trend down. The state of Michigan cases per million are in the middle here. And again, still very high, but continuing the slow downward trend. The percent positivity is on the top at 25%, and again, gradually declining. And the daily hospitalization rate is on a slow decline. The case rates per age, the highest, I know it looks a little confusing here, but if you go over to this side here, the most recent, you will see that they do indeed follow this order. So the highest case rate per age is in the 30 to 39-year-olds, followed by our school age kids, the 10 to 19-year-olds, then 40 to 49-year-olds and 20 to 29-year-olds. So still the young adults and our middle school and high schoolers. This I showed a couple weeks ago. I just wanted to show the update of it. These are several different projection models of where we might be headed. This red dot is where we are now. The black dots are just some points in time of where we have been. The yellow line is kind of the most optimistic projection. And for the most part, for our case numbers on the left, and the hospitalizations in the middle here, and these are weekly, it does look like we may be following kind of the most optimistic projection. So hopefully we are on the downward trend, and hopefully by the end of March, we may see kind of the end of this surge. There are some projections that mention, and they discuss it over here, that there may be a second surge in hospitalizations or deaths, and that we do sometimes see what they call a lagging indicator, because people often get worse or die a few weeks after they are infected. But fingers crossed, we'll hope that we continue to follow this downward trend and do see some good improvement over the next 4 to 6 weeks. The hospitalization rates continue to go down. The ICU cases continue to go down. The child or pediatric hospitalization counts still very high, but continue to go down. That was my last slide, just to get another reminder, just so you can have it on your schedule, that 2 weeks from today, we will not have a meeting. But otherwise, that was all the new information I had to share today. Let me stop sharing my slide here. And if you have any questions, please put them in the chat box. I did have to mute everyone's line prior to the call, and sorry, I just saw a message there that somebody couldn't hear me. I did have to mute everyone's lines at the beginning, so if you have a question you'd like to ask out loud, you may need to push *6 on your phone if you're talking on your phone. So just a mention of that there. Going through. I don't see any questions in the chat. Thank you for sharing the links again. Oh, here we go. We keep getting parents saying that the quarantine days are going back to 10 and that masks are not recommended by the CDC anymore. I don't see information for either. Have you heard anything? No, we have not heard anything. We have not changed that. There is an option for them to be out for 10 days if they're not willing to wear a mask for those days 6 through 10. But it's still the same as it's been written this last update. So if you could ask them if they have anything in writing or a reference and send it our way, that would be great. But I think maybe sometimes, things get changed in gossip, or there's just different, people just do things their own way. The next question is, since school districts are doing much more testing, what is the recommended way to dispose of tests given? Should there be a different way to dispose of positive tests versus negative tests? Nope, they can just be disposed of in the same way, and any expired tests that you may not have used can also just be disposed in the regular trash. So, any other questions?
Dr. Morse,
Yep.
this is Sean Petrie, Core ISD. We know that we're uploading all of our positive tests when we have those as individual tests. The schools are doing that. Negatives as an aggregate, positives. Can I just ask a question? Maybe it's a question that I don't know the answer to, everybody else does, but that's when the positives go through, does the health department see those, or where's that stored? For example, because a lot of us are letting health departments know we have positives, plus we're uploading it into that system. Are you able to see the positives as the schools are uploading those?
Yeah, so those go to the state, and then they individually put those into the Michigan Disease Surveillance System. So if we were to then look up that student, we would see them in the system. And then they get counted they're counted as a probable case with an antigen test. But yeah, they do get counted that way, and we are able to find them they don't individually send us a separate report saying, here's your cases from this school, but they are in the system where we could find them. It usually takes a few days for all that to happen, but that's what happens with those reports.
Okay, thank you.
Yeah. Any other questions? I guess the other thing I did not mention, but it is sounding as though the vaccine for children under 5 may be approved quite soon. In fact, we'll be having a meeting, I think it's next Wednesday. There's been planning meetings already with the CDC and the state kind of discussing how it's going to be rolled out. And there's a meeting with the FDA scheduled to discuss the approval. So just as a heads up that you know, is on the horizon. We're really not sure what the uptake will be in that age group, but just so you're aware, and that would be the Pfizer vaccine. The Moderna vaccine did get full FDA approval. So it's called Spikevax. So it's not just got the emergency authorization, it does have full FDA approval now. So those are just a couple of updates. I'll keep you posted as those things become more official, but just wanted to let you know. All right. Well, I'll send out the slides and the video as well as the memo and the flyer about that webinar so that you have those things. And if you think of any other questions or anything, let us know. Otherwise, we'll talk next week. And if you think of anything in the meantime, let us know. And if there's anything you want me to make sure and cover during one of these talks, just make sure and let me know too. All right, you guys, have a good rest of your week and have a good weekend.